So the Transform study was a pivotal phase 3 randomized study comparing Lisocabtagene Maraleucel, or liso-cel, versus standard of care, which consisted of salvage chemotherapy followed by autologous transplant in responders in patients who had primary refractory large B-cell or relapsed large B-cell within 12 months of frontline chemoimmunotherapy. I presented on behalf of the co-authors at the ASH 2021 meeting a pre-specified interim analysis of the Transform study. And I am delighted to state that the study met its primary endpoint of event-free survival. The event-free survival was statistically significant and superior for the liso-cel arm at 10.1 months versus only 2.3 months for the standard of care arm. It also met key secondary endpoints of complete response rate, which was statistically significant and higher at 66% versus only 39% for the standard of care. It also met the progression-free survival key secondary endpoint, where the liso-cel infusion had a median PFS of 14.8 months versus only 5.7 months for the standard of care arm. Important to highlight were the overall survival curves. Although at a median follow-up of 6.2, the data remains immature and it's a short follow-up, it's really striking to note that the two curves are separating. And at this point, they're trending towards liso-cel. So we are very, very excited to see what a longer-term follow-up will do to the overall survival curves. In terms of safety, safety was extremely manageable. There were no new safety signals that were seen. Especially important to highlight that there were no grade 4 or grade 5 CRS, cytokine release syndrome, or neurological events that were seen with the liso-cel infusion. So to conclude, this phase 3 study at its pre-specified and interim analysis has met its primary endpoint of EFS and key secondary endpoints of PFS and complete response rate, with a trend in overall survival favoring liso-cel, with no new safety signals seen. So this represents a potential new standard of care after nearly 2 decades for this high-risk cohort with relapsed refractory large B-cell lymphoma.